Today, we're going to deconstruct a really critical system malfunction inside the human body, the silent heart attack. Now, this isn't just a medical event. You can think of it as a profound failure in the body's internal warning system, one that's misunderstood, often misdiagnosed, and dangerously quiet. So let's break this malfunction down.
So, when you think of a heart attack, what's the first image that pops into your head? For most of us, right, it's this dramatic, unmistakable event. The system sends out a clear, centralized alarm that's just impossible to ignore. But what happens when that primary alert system is, well, offline?
The signal we're all trained to recognize, the one you see in movies, is that classic centralized chest pressure. An unrelenting tightness, a heaviness. It's what we've come to expect. The problem is, that expected signal, it isn't always transmitted.
And the sheer scale of this system failure is what's truly, truly alarming. According to Harvard Health, nearly half, a staggering 45% of all heart attacks are silent. Think about that. For almost 1 out of every 2 heart attacks, that classic signal is never sent, or it's so faint it goes completely unnoticed.
This brings us right to the core of the problem, the silent malfunction itself. We're talking about an event that causes just as much damage as a classic heart attack, but it does it without setting off the typical alarms. And understanding this is absolutely critical because you can't respond to a threat you don't even know exists.
Let's get precise for a second. The technical term is Silent Myocardial Infarction, or SMI. The key words to focus on here are unrecognized or no symptoms. But make no mistake, the underlying mechanics are identical to a classic heart attack. You've still got a blockage of blood flow, and it's still damaging the heart muscle. The danger is just as real. And the consequences of this silence, well, they're severe. Data from Harvard Health shows that people who have a silent heart attack, and because of that don't get treatment, have a 3 times greater risk of dying from coronary artery disease. The lack of a signal leads to a lack of intervention, and that is a fatal system flaw.
So why does this happen? How can something so major go unnoticed? The answer really lies in a fundamental breakdown of communication between the heart and the brain. It's a neurological disconnect where the distress signals from the damaged heart tissue just never get properly received and interpreted as pain.
And this is the crucial question, isn't it? If the heart muscle is being damaged, why doesn't the brain register the emergency? What is interfering with the transmission of that critical pain signal? Let's take a look at the breakdown in the wiring.
A primary culprit here is nerve damage, a condition often linked with diabetes. A 2023 study points to something called autonomic denervation. In simple terms, the very nerves that are supposed to carry the pain signal from the heart up to the brain are damaged. As the study notes, this means diabetic patients often just don't feel pain with the same intensity. The signal might be sent, but the wiring is faulty.
And this really illustrates the elevated threat level. Sources from Live Hospital confirm that people with diabetes already face a 2 to 4 times higher risk of heart disease in the first place. Now, when you combine that with nerve damage that can silence the warning signs, you've got a uniquely dangerous situation.
But here's the thing. Just because the primary alarm is offline doesn't mean the system is completely silent. Instead, it often sends out a series of secondary or, let's call them atypical alerts. The challenge is learning how to decode them, because they are so often mistaken for minor, unrelated issues.
All right, the first atypical alert, sudden indigestion. It might feel like heartburn, maybe some gastric reflux. What feels like a simple stomach issue could actually be the heart signaling distress. It's an alert that is incredibly easy to just brush off.
Next up, pain in the jaw or the neck. This is another signal that's so easy to misdiagnose. The discomfort isn't in the chest, it's radiating to these other areas. So you might think it's a pulled muscle or maybe even a dental problem.
Another deceptive signal can show up as discomfort in the upper back. Again, it might just feel like a simple sore muscle, but it's another alert that gets frequently blamed on physical strain instead of the real cardiac event that's happening.
And finally, a really crucial but subtle alert, profound, unexplained fatigue. And we're not just talking about feeling tired after a long day. This is described as a deep lack of energy that makes it hard to do even normal, routine things. It's your body's energy systems being diverted to deal with a crisis in the heart. Now, certain system profiles, certain groups of people, are more likely to get these atypical alerts instead of that classic chest pain signal. Understanding these risk factors is key to improving how we monitor for and detect these events.
Two profiles are at a much higher risk of experiencing these atypical alerts: women and people with diabetes. Data from one study is pretty striking. 43% of women who had a heart attack reported no chest pain at all. And what's more, their symptoms, like nausea or fatigue, are frequently dismissed, both by the patients themselves and even by doctors, as just anxiety or digestive problems. This data from that 2023 JAM study gives us a really stark quantitative look at this. Among patients with atypical heart attack symptoms, half of them, 50%, had diabetes. 55% had hypertension. Now compare that to the group with typical chest pain. The numbers were much lower, only 28% and 23%. This shows a clear, undeniable link.
And here it is. This is the direct, dangerous consequence of those atypical signals. The same study found that 81% of patients with typical chest pain received a critical clot-busting treatment. But for the group with atypical symptoms, only 33%. That massive gap is because of delays in seeking care and getting diagnosed. The signal is missed, and the window for effective treatment just closes.
So what's the protocol here? What do you do when the primary alert system is unreliable? Well, it's not about trying to diagnose yourself. It's about awareness. It's about understanding the full range of signals your body can send and actually taking them seriously.
And this need for awareness is even more important when you realize a crucial fact. Silent malfunctions are often missed completely in the moment. The diagnosis frequently comes weeks or even months later, when a routine ECG reveals the scarring and damage left behind. That's when they finally confirm the malfunction that already happened.
You know, I think this quote from Dr. Jorge Plutsky at Harvard Health just perfectly recalibrates our perspective on this. He says, a silent heart attack is a loud signal your body sends that you have some kind of underlying health issue that needs attention. It's not truly silent. The atypical symptoms are the signal. The key is to listen.
And that leaves us with this final thought. Your body is this complex system, and it's constantly reporting its status. The question is, are you, and are we as a society, monitoring the correct signals? Understanding the system failure is the absolute first step in preventing its most catastrophic outcomes.